Good evening, everybody, and welcome to RAMP, Real Access Motivates Progress live Wednesday night podcast. I know you guys missed us last week. I am sorry. I lost two of my fur babies last week, but we are back in action tonight, and we have a great show, which we always have a great show, but I have a really good guest tonight who not only is a colleague, but also a friend. Tonight we have Annie Murphy from the Alzheimer's Association Rhode Island chapter. Welcome, Annie, and thank you for being a guest on our show tonight.
Oh, thank you, Tina. It's just wonderful to be here. And happy Wednesday to everybody that's with us this evening.
Yeah, we are so excited, and let's dive right in tonight. Why don't you tell our guests who may not know who you are and what you do?
Absolutely, Tina. Again, my name is Annie Murphy. I'm actually the program manager at the Alzheimer's Association Rhode Island chapter, and I'm really honored to be with you this evening. And I'm actually just about to celebrate my 11th year with the Alzheimer's Association. So, I in my role here in the state of Rhode Island, I oversee all of our programs and services, and our crew of volunteers that work in the community to spread awareness and understanding about the importance of early detection and diagnosis. And, we're here to support families and individuals living with the diagnosis of Alzheimer's dementia through the whole course and journey of the disease.
Oh, that's amazing. You guys do such incredible work and you help so many people. Tell us a little bit about the program and, so what people know and to what to expect when they contact the Alzheimer's Association of Rhode Island.
Oh, well, absolutely. We're part of a nationwide organization out of Chicago, Illinois, and the Alzheimer's Association Rhode Island chapter is just one of the chapters in the United States. But we work as a one large organization supporting anybody who's living with a diagnosis of Alzheimer's or any other related dementias. And I think it's really important for people to understand that many people just think that the Alzheimer's Association works with individuals who've been diagnosed with Alzheimer's. But we are an organization that supports individuals living with any form of dementia, mild cognitive impairment, as well as anybody who may be concerned with their own, memory issues. And people can reach out to us to, just talk about their memory concerns and changes and, what should I do about it? We have a very robust 24/7 helpline, Tina, and it is actually available for individuals 24/7 in over 200 languages. A lot of people, and they don't realize that, but our
Wow.
helpline is actually staffed by master level clinicians as well. So, any question that we can answer, it's a question of, where do I go for a diagnosis? Or, I'm, caring for someone who's living with a diagnosis, and what do I do? Where do I turn? What kind of resources are, out there to support us?
Yeah, I'm sure it's tough for the caregiver who's going to take care of somebody, going through this. And it's hard enough to lose somebody when you lose them, but it's even harder to lose somebody when you lose a little piece of them every day, or they're in and out of their dementia, and they may know you today, but they don't remember you tomorrow. Do you do a lot of support for caregivers? Is there a support group, or is it, what I mean? Is there a lot of help for the caregiver itself?
There really is. I mean, we have, unfortunately, since COVID, the Alzheimer's Association that March, we had to pivot very, very quickly and went from an all in person, you know, um, organization to all of a sudden pivoting to a completely virtual within about 3 weeks. Here in Rhode Island, we
Wow.
have, yeah, we had at that point we had about 27 in-person support groups going on through the state of Rhode Island, and now we are up to. We've returned to about 15, and 5 of them now are actually back in person, and the rest are virtual. And what we
Wow.
have seen, though, yep, but what we have seen, through this last year and a half, is that we're actually supporting more individuals. People have really been reaching out to the Alzheimer's Association for additional care and support. And I really believe that our support groups are the lifeline for so many of our caregivers. And the fact that, caregiving is such a, um, an unending responsibility. of care and love and supporting that individual, that sometimes people can't leave their homes, and so the virtual support groups are much more available to individuals, and we're seeing more and more individuals coming into our support groups because it's we have much more flexibility, and it's easier for someone to just go to a support group by sitting on the couch rather than having to drive 30 minutes trying to find maybe someone to come and stay with their loved ones so that they can go to a support group for an hour or two. So
Right.
we've been really fortunate. We've learned a lot in this last year. So
Yeah, I found that, finding the positive, because that's always what I do is find the positive. But the positive, I think, to COVID is you got to reach out and interact with more and more people that you wouldn't probably run into out
mhm,
and about in public. Some of the support groups that I have been on, being part of, your group or Age Friendly Rhode Island, or, what I mean, any of the support groups to a cancer, or the different, things that I just kind of like jump in and out of to make sure that the people of disability are always covered and they always have somebody, what I mean, that represents them. But I mean, you go from talking from people in England and Russia and, what I mean, all over the world,
mhm.
to in the middle of your thing to somebody you may not acquaint to in Rhode Island. You're now adjusting to, halfway across the world. I think it's so great that they have that ability to interact that way. But are you finding, because Alzheimer, I don't believe, and correct me if I'm wrong, is not an immune compromised, high risk for COVID if you have Alzheimer's. So are more and more people now coming back? Do they like the in person better? Like, what kind of feel are you getting?
So it's really mixed. Again, I think we're finding that we expected that people would want to go back into in person groups much more quickly than they are. We were able to give our support group facilitators the choice. Does your
Right.
attendees want to come back and meet in person, or do they want to continue virtual? And the majority of them wanting to meet virtually, because they're still getting that care, they're still getting the support from one another, but it's they're able to have more time back in their lives rather than having to go out in the community. And so yeah, we're not going back as quick as we thought we would. So
Yeah. I think it's great too, because you can also, while you're getting support from your peers, you're also cuddling with your fur babies. You know what I mean? You don't have to have the drive. You're not
yeah,
fighting in traffic. You're not out in the elements. So I can
exactly.
kind of see that. And I found that there's more and more events that I can attend because I'm not rushing from one place to another and trying to transfer
Right.
in my truck and get here, there. I can just click off one meeting and on
Yep,
to the next meeting, and, it's all in the same place.
absolutely.
Now, for the people with Alzheimer's, how are they feeling? Like, how are they venturing in? Would they rather be in person?
Absolutely. That is the one thing that I am hearing. So we here in Rhode Island, we actually run social engagement programs for individuals, and they're just asking, when are we going back? When do we get to go back and hug our friends and see one another? COVID has really hit this group of individuals very hard. And that social interaction, the isolation that COVID has caused is really made a real bad impact on our folks living with the diagnosis. We've seen many of our loved ones, unfortunately, because of COVID, unfortunately pass away because they're at higher risk for infection, and their bodies just can't handle these infections as well. And so we've seen many of our friends that we know unfortunately sort of progress their disease even faster during this period because of the isolation and because of routine, and then just the infection itself. So it's been really devastating for our dementia community.
Yeah, I can see that, because your routine of getting up, getting dressed, going to see your friends, having that face to face, I can see where the patient would want to be, more in person, or the person suffering from it than the caregiver. When should
Yep.
people start inquiring? Like, when do you think people should, and say, hey, this isn't just I forgot my shopping list, because, I do that on a daily basis. But when should people
You
stop
know, to
inquiring?
So Tina, I think it's even, you know, from the time we're like 50 and 55, we should start, at our annual exams, at our physical exams, talking to the physician and making sure that we have have our baseline memory screening every year. I mean, that is absolutely crucial. As soon as we become Medicare eligible, as part of our wellness exam every year, it is part of our wellness visit. So we should be having cognitive screenings. And if our physician is not giving them to us, then we should be telling them that, it's something that is part of our exam. So we need to be advocating for
Right.
ourselves, so that, we can begin, just having, knowing what our baseline, test results are, so that if things do begin occurring, that, we know what things look at as sort of a normal point. Um, you know, uh, to your point, it's really important when we start seeing, changes in our memory and our overall cognitive functioning that is beginning to impair our daily activities, our daily abilities. Where forgetting appointments that we regularly go to. Maybe we have a therapy appointment that we regularly go to, and we're not showing up, or we think it's Tuesday, and the appointment's actually Thursday, and we show up on a Tuesday. Those are the kind of things that are really, really alarming. And, you know, um, then when we start thinking about, working, if we start, beginning to have things begin to affect our functioning at work, maybe, we're, an accountant, and we're just really starting to have problems with numbers, and, mixing numbers up, simple adding, subtracting, and, just writing, typing the number in, and we're switching those numbers around, or, you know, um, where we were very good writers, and now all of a sudden we're writing illegibly,
Right.
and that's an overall job function that we have, and all of a sudden it's starting to get problematic. um, just things of those types of natures of, if we're simple, things that we've always done that's in sequence, completing a recipe, or you know um, filling out filling out a check and not knowing how to fill out that check any longer, and our,
Right.
our writing and change, those types of things that can be very, very alarming. Getting lost when we're driving, or, getting to a point where, we get someplace and we don't really even remember how we got there and why we even got
Right.
there. Those are really some very, very alarming, sort of symptoms that tells us, we need to, talk to our physician about it. And more
What do
importantly,
you see a trend? But I'm saying, do you see a trend with COVID? Because I know, especially when COVID first started and first hit, and we were all started getting quarantined in the isolation, that I didn't know one day from the next. I didn't know what was going on, because, you're just home. You're not really, you know what I mean, doing the day to day or having a routine, that I had to find that I had to put myself on a routine, that I had to check my calendar every day, so I knew what day of the week it was, just to kind of keep me in mode and not get complacent, because, the world shut down. So I don't really have to do much, how does
well,
people
but the
know the
difference.
difference between COVID and Alzheimer's?
Well, it's all right. So the fact that you are, looking at your calendar, 15 times a day, and, not recalling that you looked at it, that's a real concern right then and there. You're
Right.
looking at it, and now it doesn't make sense. What does it mean? What's a doctor's appointment? Who's Dr. Green that's on my calendar?
Right.
Those are the types of, that you're like, okay. And, you're having a conversation, your wife or someone is talking to you, you have Dr. Green, and you're like, I don't have a Dr. Green. That's when those are the types of, um, that should be a lot more alarming. And, you'll start seeing it with, friends will start noticing it, family members will start noticing changes. And then, if a lot of times, are these individuals, they have no insight that these are problematic. So,
Right.
that's alarming too, that they don't have the insight, that this is an issue.
Is there certain things that people or individuals can do to train their brain, or to keep them active, or to prolong you know what I mean, the Alzheimer's actually hitting? Like, is there something that we could be doing on our day to day, whether we're prone to it, gonna have
Mhm.
it, or not gonna have it? Is there certain things that we should be doing every day?
It's overall, we're talking about diet and exercise are two of the, most highly evidence-based, scientific that we know is that, a diet that's with, following the Mediterranean or DASH diet are two very important diets that we should be following. Exercise at a minimum of 3 days a week with, heart pumping, sweaty kind of exercise is really important for our heart, as well as our brain. We have to continue to challenge ourselves. Um, you know, doing a playing Scrabble over and over again, or doing a crossword puzzle over and again is not really challenging. We have to take on activities that are really going to challenge ourselves, that are really going to teach us a new skill. Learning a new language, taking a course on something that we've never taken before, interacting in a group of people that, with, taking on an activity socially that we've never done before. We have to constantly be challenging ourselves. And we need to do this throughout our whole life, our life course to, help us with having good cognition. You know, um, and those are the key. It's all of that together that's going to, it's kind of building a package that's going to, support our brain health, overall. So, I wish there
Yeah,
was
that's
a,
great, because I
I
mean,
wish there was a magic answer. I
yeah,
wish there
I
was a
mean,
magic,
I
a
challenge
magic
myself.
answer.
Yeah. I just challenge myself every day to learn something new. I mean, the tiniest bit of thing, just learn something new. Go check out a new website. Go check out something I might be interested in. Just find a new fun fact every day, just to challenge myself to. And that's, I mean, I don't have any of the signs or symptoms. It's just something I like to do to keep me active. But what about for the people
Mhm.
who are physically disabled? Like, I can't, I mean, I exercise, but I do 5 miles every day with my dogs, but I don't lose a pound because, my wheelchair does most of the work. So, I
Mhm.
kind of have that barrier. What does somebody with, mobility impairments, what can they do to make sure that they're staying on the right path?
But I think it's a lot of the same things. We're talking about, learning, that lifelong learning, being very, challenging your brain, taking on, if you're, you have the upper body strength and the, mobility, learn how to, learn something woodworking or carving, or learn to, quilt or knit. There's always something that no matter what our abilities are, that we can challenge ourselves. And I think that's the key right there. I mean, we can potentially all go, take a class, as long as we have the, the accommodations needed to take a class. We all can, be socially, together with individuals. And so it's challenging ourselves. We can all choose what we put in our bodies, for a healthy, diet. So again, those are things that, we really need to pay attention to. Um, it's interesting because the Alzheimer's Association is actually, has funded a lifestyle intervention study, Tina, and it's actually taking place right here in Rhode Island. It's called the U.S. Pointer Study, and I'm
Oh,
not sure if you've ever. And it's
yeah,
actually,
no, tell us a little bit
um,
about that.
yeah, absolutely. So, 2 years ago, the Alzheimer's Association decided that we were going to fund $20 million into this lifestyle intervention study, and it's actually a study that um, we are replicating this study, and it's actually, we've seen it in Finland and other countries already, but we decided we wanted to bring here to the United States to see if exercise and diet can improve cognition and ward off cognitive decline. So we're very fortunate here in Rhode Island that we are actually one of the 5 states in the country that is, offering this study. It's actually taking place at Butler Hospital, um, with our
That's
friend
awesome.
Tara Tang and Dr. Stephen Salloway. We're looking for individuals who are between the age of 60 and 79, who have a family history of either dementia or an individual who may have had some cognitive issues. We're looking for individuals who really don't like to exercise. They may only exercise 1 or 2 times a week, but who also may have some of the um, sort of the health issues that may impact cognitive health as that person grows older, like heart disease or high blood pressure, those types of things. So if someone is interested in learning more about the U.S. Pointer Study and maybe getting involved in the study, they can actually reach out to Butler Hospital at 453-6402, and you can ask for Tara Tang. They could also go to memory@butler.org for their website. And that's just another way that if an individual, wants to learn more about the study or find out if they're eligible for it, they can get involved. So,
Oh,
we're
that's
really
incredible.
excited. Yeah, you know, I'm still amazed because, like I said in the beginning, I've been with the association for 11 years. And when I first came to the association, the only way that we knew if someone really had Alzheimer's disease was after death at autopsy. And in
Right.
these last 11 years, we have been able to improve our diagnostic abilities so much. Like we now have the ability to use CAT scans and PET scans to actually see the pathology that's associated with Alzheimer's disease
Oh,
in the
wow.
brain. And so our ability to detect is 90-95% true now with these advances. We're very close to have a blood test that can detect Alzheimer's disease. And right here in Rhode Island, we're actually using or studying an eye scan just to be able to detect
Oh,
if an
wow.
individual has early stages of the disease as well. So, advances have, the diagnostic, assessments have just come a long way in the last 11 years. So, I'm just very proud to see that. And, we're now at that point that we can, start talking about prevention and intervention. So, and that didn't happen 11 years ago. So it's amazing.
That must be so cool to be there and to watch all of the progress come to
Yeah.
fruition. And I mean, it's amazing what science can do now, that we can detect things so much earlier and prolong it as much as possible. How can people get involved? How did you get involved with the Alzheimer's? Like, I want to tell a little bit of your back. Like, how did you choose the Alzheimer's Association when you know what I mean, started this 11 years ago?
Yeah.
And how can other people get involved?
Well, I, like so many of my colleagues at the association, I had family members who were diagnosed. Both my parents lived with dementia. My dad had Parkinson's dementia, and my mom had vascular and Alzheimer's disease. So, I was that young caregiver in my late 20s, really not knowing who to turn to, didn't know anything about the disease process. I said I pretty much did everything that you weren't supposed to do as a, Alzheimer's caregiver. Um, but my sister and I got through it. My background is in social work. And just in my, courses of in the work that I did, I, actually got a phone call from the director of the Rhode Island chapter at the time, saying we have this really innovative program. Would you be interested in applying for it? And I actually, my first job at the association, I was the social engagement coordinator, and oversaw all of our early stage social engagement programs for people living with the diagnosis. And so, yeah, that's my humble beginning. So, so it's I've been very fortunate to work with some just amazing individuals through our association. And I always say that I've learned most from my caregivers and from those individuals who are living with the diagnosis. They've taught me the most. So
Yeah.
yeah.
How can others get involved? How can they participate?
Well, there's one of the things people don't realize is that the Alzheimer's Association is one of the largest nonprofit volunteer organizations in the country. And we can't do the work that We do without our volunteer, and I say a volunteer of armies. I know, and because everything that we do in our community is run by our volunteers. We just finished our largest fundraising event, which was the Walk to End Alzheimer's, and we had four walks this year, and it is manned by volunteers. It takes hundreds and hundreds of volunteers um, to make sure that our volunteer that our walk, kicks off and goes as smoothly as it did. But you can volunteer on our walk committees. We have volunteers who just come into our office and answer phones and help us with mailings. We have volunteers who run all of our education programs and our support groups. And they are all overseen by our staff, and we do all their training for them. So, if a person wants to volunteer for us, they can just reach out to us. They can actually call us on our helpline at 1-800-272-3900. They can also go to our program volunteer community website, which is at alz.org/volunteer. And you can actually read about all of our volunteer opportunities. People can apply for those volunteer positions right then and there. And, one of us will reach back out to them and interview them, that type of thing. So there's just so many things that people can do for us. We're still fundraising through the end of this year. We're about $26,000 away from our overall
That's
fundraising
awesome.
goal this year. So, if people are interested in, volunteering or donating to the Walk to End Alzheimer's, they can just go to alz.org/walk and find one of the walks here in Rhode Island and help us reach our goal this year, which is, we're so close this year. And, it's absolutely imperative that we reach our goal, because the Walk to End Alzheimer's actually supports all of our programs and services that we offer here in the community. And we're able to offer all our programs and services because of the fundraising that we do, and we're able to offer our programs and services at no cost. So
That's amazing. Is there an age minimum or an age limit to volunteer? And also for all of the students who need like volunteer hours for high school or,
yeah.
would you sign off on them? Is that an opportunity for them to go down and, donate their time to a worthy cause and get, their hours served for school?
Absolutely. We have so many students from, high schools and colleges come and either do a community service for us or a project. We have interns from every college and university that we work with every semester. So there's so many opportunities for people to get involved. We had just an example last year. We had a young lady from Barrington High School who actually wrote a book, and in the perspective of what it was like to be a young person in middle school taking care of her grandmother. And so she wrote this book.
Oh, wow.
She wrote this book, with advice for other, children who were going through it just like herself. And and that was just a school project that she wanted to do. So she reached out to us just to, get some, information and advice and, just a little bit of support on, writing her book. And so she did that as a class project. And, so it's amazing what young people can do. We have, kids who, volunteer at, we have a conference every year in April. It's called the Alzheimer's Rhode Island Chapter Caregivers Journey Conference, and that takes place on April 21st this next year. And we have, high school students come and volunteer, just to be greeters at the, throughout the day, and we allow them to participate in our programs and the workshops, and so they're giving back but also learning as well. So
It's amazing because the younger that we get children involved and the more that they get involved in worthy causes like this, they end up having more empathy and, can deal with the day to day. Because like you said, that young girl dealing with her grandmother, how many other children did she help with her book? you know what I mean, to help them get through it. We don't think about that.
Right.
We think about our struggles and how we're dealing with, you know, trying to take care of them or care for them, but we don't figure out the children or the grandchildren that, you know what I mean, are also involved. And it's amazing. It's just so amazing. So any student out there that needs some volunteer hours, get in touch with Miss Annie Murphy, because she's incredible. So, and get your volunteer hours in, because what a better way than, you know, something so important. But let's get back to the walk. And you had an absolutely gorgeous day this weekend for your walk. So tell us all about the walk and, you know, all of the stuff that went on and how people could still donate.
Absolutely. So, this year we were very lucky. Because of COVID last year, we were not able to all walk in person, but we were able to lift some of the restrictions, and so this year we were back in person at all four of our walks. Um, we had a walk in Providence at Roger Williams Park. We did another walk on Block Island. A
Wow.
walk in Westerly, yep, at Musquamacut Beach, and then the Newport walk at Fort Getty. So, our last walk was on October 3rd, which was at Roger Williams Temple of Music. We had about 1,500 people at that walk, and I have to tell you,
Wow.
it was so wonderful to see people get back together. People were just hugging and just so happy to be back together. To honor their loved one who was living with the disease, or in memory of someone that they loved and dear to their heart that had passed away. So we had people coming together where they had created their own walk teams, created their own T-shirts, in memory of somebody, and it was just an absolutely incredible experience to be with individuals who had come together for such an important cause to end Alzheimer's disease, and to see the emotion that was there was just breathtaking. My staff and I were talking last week about, trying to kind of count out how many walks we'd, each attended. And I've probably attended at least 40 walks in my
Wow.
time at the Alzheimer's Association. And I still cry at every single one of them. We have such a moving um, service where we actually have these pinwheels, and that each pinwheel actually signifies, it's a pinwheel flower, and each pinwheel signifies who you are at the walk. And so blue represents that you're the person living with the diagnosis. Purple signifies that you lost someone to the disease. Orange is that you are a caregiver, and yellow is that you are just there for the cause. And I can't tell you how many times people came up to me and said, this is but the first time that I'm actually carrying the purple flower. And, they lost their loved one during this last year and a half because of COVID. So that was just such you know, that was a very, very emotional, experience for me. But just, hearing that over and over again this time at the
Right.
walk. So, when people walked to 2 miles together, and it was just a really, really wonderful time. And I can tell you, being all together again was just amazing. We had to follow. We still had, COVID restrictions. We had to follow. People had to wear masks, and we had to have social distance. But we were all together again. So
Yeah.
so,
It's amazing. I
we are
mean, the
still
isolation, yeah, the isolation is real, and people are just lonely. They're just sick of being alone, whether they have the disease or not, or have anything. I mean, people are just lonely and, staying by themselves. And I find that when you're out and about, even just like on my morning walks with my dogs, people are so much nicer. People just love seeing that smiling face coming down the road, or, passing each other and stop for a minute to talk. That something like this, when you have the common bond, um, I can't even imagine it. It's got to be something incredible.
It really is. And and I think, that is something that's so important, is that, so many of our families who are living with this diagnosis, they talk about the isolation, and, you know, the fact that many of them, say that they lose a lot of their friendships, with people that, they, used to socialize with, and how caring for someone with this disease is very isolative. And, so I really, really encourage, families and friends to try and, stay connected, stay involved, try to find out how you can support that family and support, especially the person living with the diagnosis. And what can you do? Don't be afraid to ask the questions. Don't be afraid to, make mistakes, and, just ask, what can I do? And,
And
still
don't wait
continue to be.
for, yeah, and don't wait for a walk. This is an everyday issue. This isolation and this disease is an everyday issue. So when you go to these walks or you go to these support groups, stay in contact. Try to contact somebody once a week, you know what I mean, that's dealing with this. Try to meet them, try to get them out, or just go sit on their front lawn for 10, 15 minutes and have a conversation. It's not just for these walks 4 times a year. These are also
Nope.
an everyday issue, especially with the holidays coming. This is the most important time that you need to be reaching out, that you need to be involved. And that's for anybody, whether they have Alzheimer's, cancer, disabled, elderly, or, young people who are just by themselves or their family lives elsewhere. Reach out, make that connection to somebody, because it's gonna change your mind. It's gonna open your mind. It's gonna exercise your mind and your heart. And it's important to reach out. Anything that you want to say on that, Annie?
You know, I keep thinking, we're almost starting to talk about the holidays, and, it is absolutely crucial that we continue to support, those individuals who are living with the diagnosis. Your friend who's living with the diagnosis, may be changing, but you know what? You'd still need to be there as their friend, and it may, what you might have done with your friend, you may have gone and played golf, or, maybe the two of you used to get together at Dunkin' Donuts and have coffee, every, once a week. You can still do those things with that individual, but realize that, that their level of their abilities are going to be changing. And so maybe you'll have to adapt, how you're going to play golf, or maybe, you'll have to adapt to, maybe just going to get the coffee and bringing it back to their house, but continue to, do the things that you guys used to always do together. And, because that person still needs those social connections, just as much as the caregiver does. Because I know so many of my, think about it, think about the person living with the diagnosis. They may now have, all the things that they're losing. They've lost, potentially they've had to quit their job because of the disease. They may no longer be able to drive. They don't have that independence that they originally have. They just they're losing their abilities. So we have to help them find what are their, what are their remaining abilities, and what are the things that they still continue to enjoy, and do those things with them. And so we're the ones who has to constantly be evolving and changing, because we have to continue to adapt to how their functioning is changing. And again, to always just, focus on their remaining abilities, and, and what makes them, thrive. So.
Yeah, it's so true, because, and that goes for everybody. As hard as it is on you to adapt and to change, imagine what it's like for the person that's actually going through it and living with it 24/7. You may only have to see them a couple of times a week, or, a couple of hours a day. They're living with this 24/7. You have no idea what they're actually going through. So as hard as it is on you, try to put yourself in their shoes or in their wheels and realize what they're going through, because they don't get a break. They don't get to just walk away and change the subject or go visit somebody else. So as hard as it is on you, it's harder on them. So make sure you're putting yourself out there. Annie, give everybody the website, the phone number, the contact information of how people can interact and get involved.
Absolutely. So the Alzheimer's Association's 24/7 helpline, which I think is still our, is that first place that you should go. And that is at 1-800-272-3900. And then our website at alz.org has just so much information available. We have a safety center. We have, you can actually go in and have the ability to actually create a short-term and long-term care plan with the assistance of,
Oh, wow.
our website. So there's a lot of opportunities for us to learn, just through that. And we also have one other website that I like to tell people about. It's called the Community Resource Finder. And that's communityresourcefinder.org. And that is actually where we house all of our programs, our educational programs, and our support groups. So you can go in there and just, put in your zip code, and it'll list all of the upcoming educational programs and support groups that occur in your area. And it's also a great resource for finding diagnostic centers, therapists, home care agencies, assisted livings, adult day programs. So, I encourage people to use that website as a way of finding resources that are in their particular area. So.
Yeah, and that's for across the country, right? That's not just for Rhode Island. That's for anywhere you are in the country. You can go to that website and you can find local
Absolutely.
support groups and stuff for you. We have tagged your Facebook and your social media in this post, in this video. This will also, your website and your social media will be tagged on our website, rampisinclusion.com. So when you go to this podcast on our website, your email and all of your information for people to contact you is all right in there, so people will be able to check that out as well. I don't know if we lost Annie. We lost her picture, but so definitely go to Alzheimer's Association Rhode Island chapter. You can find them on all social media. Like I said, we have tagged them in all of our posts. The Alzheimer's Association is a big supporter of the Red Bag Initiative. We give them out to as many of their clients and patients as possible. It's carrying all of your medical information on you at all times, and it's non-tech based. That is the most important thing that you can go. So go to www.rampisinclusion.com, and you will be able to go and get your red bag for your loved ones or for yourself. Annie, welcome back. I think we lost you there for a quick second, but I was going how everybody can get in contact with you. Give us your final thoughts and give us the most important thing you want people to take away from, this podcast tonight.
So I think it's two things. I think it's really important that people know what the early warning signs are, and that you, talk to your primary care physician about those warning signs. And number two, how important it is for us to really support the individual living with the diagnosis and their families, and that we need to continue to support them and find out everything that we can about Alzheimer's disease, the type of dementia that you're living with, and how we can support that individual, through the journey of the disease. And don't wait. Plan early. If anything, if I can say anything, it's how important it is for us to get things into place so that we can support that individual through the journey, and especially if something occurs, we're prepared for it. So.
Yeah, I mean, it's never too early to ask a question. Education is power. I mean, this may be something you never encounter. I highly doubt it, because you're going to encounter somebody suffering or, going through this disease. So educate yourself, because you know what? Tomorrow it could be you or a loved one that's dealing with it, and you'll have the education and the power, or at least bare minimum, you have the resources, or you know where to go to look to get the resources if something pops up that you weren't prepared for. So educate yourself, volunteer, donate. You can still go on and donate to any of the Alzheimer's walks. They're $26,000 from their goal with what, 3.5 months left. Let's get them to their goal. Let's find this cure. Let's end Alzheimer's, so nobody else has to suffer with this horrible disease. And we want to make sure that everybody dealing with it, from the patient to the caregiver to the family members to somebody that's, just a friend, we want to make sure that you're getting the support that you need and that you're doing the right thing. So you're not doing all the wrong things that we tend to do because we think we're doing the right thing. Annie can actually give you the right things to do at the right time. Correct, Annie? Give us those websites one more time and phone numbers.
Okay, so our 24/7 helpline is 1-800-272-3900, and our website is alz.org.
And the resource website?
That's communityresourcefinder.org.
And like I said, you can go on to rampisinclusion.com, rewatch this podcast, and the link is right there to their website and their information. And you can click right on it and get in contact with Annie. And if you can't find any of that, just message me, because if you're watching this, you can message me because you're on my Facebook page right now watching me. Message me and I will make sure that I get you the information to be in touch with Annie, so that way you never miss a beat, you never skip out and do anything, and you're always doing the right thing. When's the next walk, or when's the next big fundraiser? I know it's probably going to be next year, but let's get people prepared.
Well, you know what? I don't even know the dates of our next fundraisers, but what I can tell you, and I want any of our family members to be aware of, is on April 21st of 2022. Wow, that's amazing. We are actually having our annual Caregivers Journey Conference. As of right now, it is going to take place at the Crown Plaza in Warwick, Rhode Island. It'll be a full day conference of educational programming and resources and services for families living with the diagnosis of Alzheimer's dementia. And there's no cost for our caregivers, but there will be, we'll be offering CEUs and specific tracks for our professional caregivers as well. So, mark your calendars, and, we should be, people should begin hearing about it starting in January and February. And, so people can register and, come to one of the most valuable, I think, resources and programs that we offer throughout the year is the annual Caregivers Journey Conference for our families. So,
well, definitely mark me down for a volunteer, because I will be there and I will help you guide to make sure everything is fully accessible for anybody who shows up with any mobility device, because that's what RAMP does. So we will go to your event and we will make sure that you are all set up, and count me in as a volunteer for that. And talking about caregivers, next Wednesday night, we have the Caregivers Guardian with Nadine Roberts-Cornish. So everybody's going to want to make sure that they tune in for that, because if you're a caregiver for Alzheimer's, this is a great 10-10-30 campaign that they run every November. Nadine, if you have not met her, just talking to her for 5 minutes will inspire you. She did the United Way's Caregivers Conference. She was a keynote speaker. I believe it was last year. She's absolutely amazing. So everybody tune in next week. But definitely, one more time, give us those numbers and email websites so everybody can contact you.
All right. So the Alzheimer's Association's 24/7 helpline, which is in over 200 languages, is 1-800-272-3900. The Alzheimer's Association website is alz.org. And I want to let you know you can actually translate our website into over 200 languages as well. My email, if anybody wishes to get in touch with me, is mmurphy@alz.org. And then last but not least, our community resource finder is at communityresourcefinder.org. So,
how can they still donate? What is the website for them to still donate? Because we're going to hit that goal this year.
So if you're interested in, thank you for donating. So it's alz.org/walk/RI.
Nice. So make sure you're going to that website and you are donating. If you don't have the funds to donate, go to the volunteer site and volunteer your time, because it costs nothing to volunteer. Or just go and educate yourself. Go and make sure that you know everything there is to know about Alzheimer's. Make sure that you're staying involved and inclusive, because like I said, you never know when it could happen to you or a loved one, and it's better to be prepared. Knowledge is power. Make sure it happens. And then come see me and Annie in April 21st of 2022 at the annual Caregivers Conference, because you'll get all your information there. So thank you, Annie, so much for sharing all of your insight. We are going to help you hit that goal somehow, some way. We're going to share and share and share to make sure that you hit that goal this year. And if anybody wants to get in touch with Annie and they missed all the time she gave the phone number and website, reach out to me and I will put you in touch with her, because she's an amazing individual. And like I said, not just a colleague, I get to call her a friend, and I am so excited. Thank you for taking the time to be on our show tonight, and we will see you all next week for the Caregiver's Guardian with Nadine Roberts Cornish. So don't just sit there, everybody. Make a difference. We'll see you next week. Have a great